Hi, I'm Michael Hartman. I'm a professor at National University Hospital, where I work as a breast surgeon. You may be aware that gravity never fails. Newton does not give up. So things will drop to the earth over time. And that's a normal development of a breast. So over time, the breast will drop. They do so for a few reasons. It's because the gland, as a woman gets older, eventually disappears and it's replaced by fatty tissue. And as such, the firmness of the breast is a bit different and it's become softer and it does drop. A woman would be concerned that she has breast pain. Now, for a woman, on every cycle, there is the possibility for a woman to get pregnant. And the breasts, being milk-producing factories, they get ready for the opportunity to make milk in case a woman gets pregnant. And that process of preparation means that the breasts, they swell up and they become quite tender. It's uncomfortable and it can be actually alleviated by means of things like primrose oil. When breast cancer is just a grain of salt in your breast, you won't feel it, you won't see it, and you need to allow us in the hospital to take a picture of your breast by means of a mammogram to find it. If you wait a little bit, then this seed will develop into a mass or a lump. That lump can be felt when it gets a little bit bigger, maybe about 1 to 2 cm in size. So if you're a woman and you feel a lump, then definitely should go to the hospital. There are a few other symptoms. Changes of your nipple, if it gets pulled in, an eczema on the nipple, or any kind of skin change should also prompt you to come and see us. So a lump on the breast, all it tells us is it triggers us that you need investigations. You need mammograms, ultrasounds, possibly a biopsy, but the underlying cause of that lump could actually be a water cyst, which normally all it needs is for that water to be drained. Or it could be a benign, non-cancerous lump. So the majority of all lumps, especially in young women, they're non-cancerous. But in older women, the likelihood that it may be cancer increases substantially. So they can, depending on the stage of the cancer, mean more imaging. It can mean starting with chemotherapy or starting with surgery. But it's a process where you partner with your healthcare provider in the next steps, ideally also with your loved ones. You can do a lot. I think this is where it's important to partner with your loved one in this journey. Because if you do so, you can be there, you can be the additional ear to listen, you can be that supporting person in need of despair, anxiety, etc. So as a loved one, it's important to be present in this journey. And it's a long journey. Breast cancer treatment, on average, can take between 6 months to a year. So you need to be in there for the long haul.